Hi, I'm Dr. Monica Gabriel, and you can pronounce that Gabriel or Gabriel. I use she, her pronouns. I'm a bisexual slash plurisexual Coptic Egyptian Canadian woman. I am currently a postdoctoral fellow at Western University in the Schulich School of Medicine and Dentistry in the Department of Epidemiology and Biostatistics. I obtained my PhD from the University of Toronto, where I studied health and social psychology. Generally, in that position, I looked at resilience and health with queer people of color. So I developed the first measure of identity affirmation with queer people of color called the Queer People of Color Identity Affirmation Scale. I also conducted the first study of autonomic resilience in that population. So that involved looking at cardiovascular reactivity and regulation in the lab with queer people of color and comparing those metrics with performance on psychosocial measures, including the one that I developed myself. I've also been able to have a more focused look at experiences of bisexual people of color. So that involved looking at visibility internalized by negativity, but also looking at resilience and strength in that population. In terms of what I'm doing now, like I said, I'm a postdoctoral fellow. Working with Dr. Greta Bauer on two projects, the Trans Pulse Canada project and the Trans Youth Canada project. And those projects are both looking at health and gender affirming care with trans and non-binary people across Canada. I'm also the chair of the awards committee in Division 35, Section 4 of APA, and Section 4 is the Lesbian, Bisexual, and Trans Concerns Committee. And I'm also a collaborator with the Queer and Trans Research Group at Dalla Lana School of Public Health, which is run by Dr. Lori Ross. In terms of the steps that I've taken to get where I am today, for one, I took some time off after I finished undergrad, and I think that can be really scary to hear for a lot of undergraduate students because you really just want to gun it and get to grad school. But that was a really key period for me where I finally had time to breathe after undergrad because undergrad can be really overwhelming. I remember that very well. And there's a lot of work that goes into it. It kind of amazes me that undergraduates have to go through so much. So I took 3 years off and I spent that time, like I said, resting, but also working, conducting research, figuring out the kind of research I want to do, and also coming out and learning about myself as a queer person and learning about how that, would inform the research that I would eventually do. And then when I got to grad school, I looked around and I saw that there wasn't really anybody who looked like me. There were very few ethno-racial minority people there and very few out queer and trans people. So that was hard to begin with. I felt, a bit isolated and didn't really know who to communicate with and who to find connection with. I was lucky I found some like-minded others in the department, even, if they didn't look like me or have similar lived experience as me. And then beyond that, I sought community outside of my department. Again, I think this is something that a lot of people don't think to do because, you think I'm in psychology, this is my world now. But psychology is well positioned to be interdisciplinary. So you can also look towards public health, for example, or other departments. So that is what I did. I found a queer and trans research group in the School of Public Health and I asked if I could join. I started attending their meetings and I found a really great community there. And I also found community at conferences. So I was really privileged and able to go to conferences and found many similar others in APA. So they have a division there for queer and trans people and a division for ethno-racial minority people. So I found really wonderful friends and amazing researchers in that world as well. Now, related to that, finding mentorship can be really challenging. And that was a challenge I had. Even though I had an advisor who was really lovely and supportive and really prioritized mental health and made that evident to me. I also wanted to find people who conducted queer and trans research and, identified as that as well. So again, I found that in Dr. Lori Ross. I just did some Google searches and found someone at U of T who I felt could be a good mentor to me. And I really lucked out there because she ended up being an amazing mentor to me. So you might have to do some footwork for yourself to find the right mentors. And again, you might have to leave your department. And in terms of why diversity and inclusion is important in my line of work, I think that answer can be similar in many fields and many lines of work. In terms of psychology specifically, of course, psychology involves the study of human experience. So, for one, if people are interested in studying the experiences of vulnerable populations, but that entire research lab belongs to a privileged or majority population and don't have that lived experience, a lot of the times those researchers don't really know what to ask. They're viewing, for example, community through their own lens and through their own experiences and what they understand of, for example, white community spaces or queer white community spaces. But if you do have someone leading a project or at least informing a project who has lived experience, then it can really guide the research and guide you to actual more accurate findings and research questions, more applicable research questions. Mentorship is, of course, a huge piece of why diversity is important. When undergraduate students look toward faculty and don't see faculty who look like them or have similar lived experiences as them, I think that really limits what they believe they can do. So when we do have a diverse faculty that reflects the undergraduate body, the diversity of an undergraduate body, I think that can really be very meaningful to those undergraduate students. So, for example, at my institution, we have a very diverse undergraduate body, but much of the faculty, especially in psychology, don't reflect that. And so I think, like I said, that limits what undergraduates believe they can do. It also can restrict the opportunities there. So, finding people who will let you work in their labs or who will write reference letters to you. And then reference letters and opportunities end up going to the students who are more similar to the faculty that's already existing there. And also in terms of, for me, this was an issue, doing research that is very personal and also social justice oriented. If you belong to a department that doesn't conduct that kind of research and doesn't prioritize that kind of research, and that research is deeply personal to you, that can send a certain message to a person, that your population, that your community isn't prioritized in a department. So I think when you have a department that is diverse and those people are able to recognize the value of research that acknowledges and celebrates certain communities, that can be very meaningful to students to see that your research and therefore your community are valued. So that is pretty much what I have in terms of answers to the questions given. I'm really happy to be participating in this panel and I'm looking forward to it. Thank you.